It is evident that Patrick has developed several respiratory symptoms as a result of long-term cigarette smoking and the development of chronic obstructive pulmonary disease, or COPD. As Patrick was a smoker for 40 years, his lungs would have suffered severe damage from the carcinogenic in tobacco and as a result caused the development of COPD. Patrick's previous smoking and current dyspnea suggest that he may have developed emphysema, which causes an increase in the use of accessory muscles, influencing Patrick's fatigue. In addition to this, Patrick's air spaces in his lungs would be permanently enlarged due to the loss of elastic recoil within his alveoli, causing air trapping or lung hyperinflation. Patrick's age is also a contributing factor to his respiratory symptoms, as the aging process causes a gradual deterioration in lung function and capacity. COPD can be categorized by progressive and irreversible damage and can create complications such as pulmonary hypertension. Pulmonary hypertension occurs because the blood vessels that carry blood between the heart and lungs become narrow or hard, raising the blood pressure within the lungs. This increase in pressure can damage blood vessels within and around the lungs, causing blood or fluid to leak into surrounding tissues. Patrick's edema or swelling in his legs may have been the result of pulmonary hypertension or left-sided heart failure. In individuals with left-sided heart failure, the left ventricle, which pumps oxygen-rich blood to organs throughout the body, begins to deteriorate and pump less efficiently. Not only does this prevent the body from receiving a sufficient amount of oxygen-rich blood, but causes blood to back up into the lungs and as a result cause symptoms such as shortness of breath or edema. As Patrick's heart rate was measured as 155 beats per minute, it is much faster than the normal range of 60 to 100 and thus outlines Patrick's development of tachycardia. Based on Patrick's weight and height, he has a calculated BMI of 29.3, which categorizes him as overweight, as his suggested healthy range is 59.9 to 80.7 kilograms. Yadav, Agrul, Shah, and Islam suggest that carrying excess weight in the form of stored fat increases an individual's muscle workload, causing an increase in heart rate. In addition to this, when the demand is high, the heart must pump more efficiently to deliver additional oxygen-rich blood to muscles for energy and metabolism. As Patrick is also suffering from left-sided heart failure, it is likely that the right side of his heart is pumping harder to compensate for the inefficiency of the left. Therefore, in order to continue to deliver oxygen-rich blood to Patrick's extremities, his heart must pump faster and more aggressively to ensure this. As a result of an increase in cardiac output and pumping capacity, Patrick's heart rate increases due to a high sympathoadrenal discharge or response. Lastly, as Patrick was a smoker for 40 years, the effect and toxins within cigarettes would have damaged his cardiac function. Nicotine causes blood vessels to constrict, which forces the heart to pump more efficiently to deliver oxygen-rich blood to major organs. Not only is smoking associated with a raised blood pressure and the thickening of the artery walls, but a decreased level of oxygen, which triggers symptoms such as dyspnea and fatigue. It is most likely that Patrick has developed COPD as a result of consistent cigarette smoking over several years. COPD is characterized by airflow limitation and is associated with an abnormal inflammatory response. The loss of lung function is usually caused by emphysema due to the damage of lung tissue and the narrowing of small airways. As a result, chronic inflammation, fibrosis, and the loss of elastic recoil can occur, which can cause symptoms such as air trapping and shortness of breath. Due to Patrick's previous smoking status, myocardial infarction, high blood pressure, and weight, he has developed left-sided heart failure. Due to the weakening of the left side of the heart, it has become more difficult for his heart to efficiently pump oxygen-rich blood throughout the body and to the lungs. Patrick's fatigue and dyspnea have also increased as a result of his body's demand for oxygen-rich blood, particularly when under exertion. If the heart is unable to maintain a sufficient blood supply, blood can begin to back up into the lungs, which results in fluid retention and shortness of breath. Even though COPD is not directly related to left-sided heart failure, both conditions can aggravate each other. Low oxygen in the blood from COPD can place a strain on the heart's ability to pump blood efficiently, which worsens left-sided heart failure. In addition to this, too much fluid in the lungs as a result of heart failure can cause severe dyspnea in COPD individuals, as fluid retention interferes with passive breathing. Lastly, if blood is not oxygenated due to the interference of COPD, stress and strain is placed on the heart, which consequently worsens the symptoms of left-sided heart failure. Therefore, Patrick's history of smoking contributed to his development of COPD, which influenced the symptoms of left-sided heart failure.
There are several factors contributing to Patrick's risk of developing right-sided heart failure. Firstly, right-sided heart failure, or cor pulmonale, is a dilation of the right ventricle as a result of high blood pressure caused by chronic obstructive pulmonary disorders. This leads to insufficient blood supply to the lungs for oxygenation. As Patrick already suffers from left-sided heart failure, which is the most common cause of right-sided heart failure, his left ventricle is unable to efficiently pump blood to the systemic circulation. This causes the backward effect of pressure buildup into the left atrium, then into the pulmonary circulation, and finally into the right ventricle, which will eventually fail. This leads to blood accumulation and edema throughout bodily organs, which can lead to an enlarged liver or an enlarged spleen. Lastly, right-sided heart failure also has a forward effect of reduced output to the pulmonary circuit. As blood accumulates in the systemic circulation, it can cause peripheral edema. This then means as the blood flows through to the pulmonary circuit, there is an insufficient blood flow through the lungs, causing the impairment of gas exchange and reduced output. Patrick suffers from COPD, where high blood pressure in the pulmonary arteries will increase the workload of the right ventricle, eventually causing the right side of the heart to fail. Patrick has a BMI of 29.3 and a waist circumference of 104 centimeters, which suggests that most of his body fat is stored within his abdominal visceral organs. Abdominal fat is susceptible to changes in lipid metabolism as well as a decreased insulin response, which can cause an increase in blood lipid levels. Excess abdominal fat also causes insulin resistance. Patrick's high levels of low-density lipoprotein and low levels of high-density lipoprotein, along with high triglycerides and hypoglycemia, can be directly associated with diabetes mellitus. Patrick's risk factors contributing to dyslipidemia include smoking, and although we do not have more background information on him, it can be assumed that due to his waist circumference, BMI, and other comorbidities, he has a sedentary lifestyle and/or a high intake of cholesterol and saturated fats. High levels of LDL and low levels of LDL are associated with amyloid deposition in the brain, where proteins called amyloid build up on the walls of cerebral arteries, increasing the risk of a stroke. Patrick's blood test results also reveal hyperkalemia, hypotassium, and hyponatremia, which is high sodium. Hyponatremia occurs when the body does not contain enough water for the amount of sodium, and the sodium blood levels rise when water loss exceeds sodium loss. A combination of Patrick's possible diabetes mellitus and his high blood glucose levels promote excessive amounts of urination, causing dehydration. Renal failure can also explain the high levels of sodium and potassium in Patrick's blood. Hyperkalemia, like hyponatremia, is caused by oliguria and dehydration. Insulin deficiencies caused by diabetes mellitus may also affect electrolyte levels, as insulin promotes the entry of sodium and potassium into cells, and low levels of insulin can mean that these electrolytes remain in the blood. Hypocalcemia in the blood, as well as low hemoglobin count, are also effects of renal failure. Sodium, potassium, and calcium are all essential for neurological function, so disruption to the neuron function may be fatal. Dehydration can cause memory deficits, as well as a decrease in the ability to perform cognitively. An arterial blood gas test is used to measure oxygen and carbon dioxide levels in the blood to show the effectiveness of the lungs in gas exchange. In addition to this test can also measure the severity of COPD and determines the state of ventilatory control, which outlines whether a patient needs oxygen therapy. The normal ranges for partial pressure of oxygen and partial pressure of carbon dioxide are 80 to 100 millimeters of mercury and 35 to 45 millimeters of mercury, respectively. Poor lung function, as in COPD or pulmonary edema, causes the buildup of carbon dioxide in the blood, leading to acidosis. Patrick's blood gas analysis would show a partial pressure of carbon dioxide of above 45 millimeters of mercury and a pH of less than 7.35, indicating acidosis, due to his current COPD condition.